Welcome to the Ask Julie Ryan Show. I'm Julie, your host, and I'm so delighted you could join us this week. My intention in doing this show is to provide information, insight, and comfort to people all around the world by helping to answer life's unanswerable questions. And we've got a whole bunch of callers on hold, so we'll get to them in just a minute. But in the meantime, it's the first Thursday of the month, and you know what that means. Da 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 da! Drum roll. I need somebody that can do a good drum roll. I'm not very good at it. I'm giving away a free session. So the winner for August of 2021 is somebody that calls themselves Trees P United Kingdom, which I thought was hilarious. I have no clue what that means, but Trees P United Kingdom. You have won a free 1-hour session with me valued at a couple $100. And so here's what she said. She titled it A Combination of Inspiration and Comfort. And she said, what a joy to have found this wonderful lady's podcast. Not only is she truly gifted, and she put in parentheses, I mean, energetically scanning people for medical issues. Just wow. But the sheer amount of knowledge which Julie possesses about spiritual issues is just mind-blowing, and yet she is so down-to-earth, friendly, and empathic. Julie has inspired me to read more, listen more, and try for that spiritual connection. I am seriously hooked. She's a gem, the real McCoy, which I thought was hilarious because that's such an American statement, the real McCoy, but here she is in the UK using it. So Trees P, UK, girl, you have won a free 1-hour session with me. So email me, julie@askjulieryan.com. And we will find a date and time that works with your schedule, and we will get you on. The reason I do this every month, you guys, is because, first of all, thank you for listening to the show. And secondly, I know $200 is a lot of money for a lot of people, especially during this situation with this global pandemic that seems to be endless. And so it's some little thing that I can do and help somebody that really wants to have a 1-hour session and they can't afford it. So it's a gift to you, Trees P, girl. I'm assuming it's a girl. Maybe it's a guy. I don't know. And we can talk about whatever you want. We can talk about medical stuff. I can scan family members, your pets. We can talk about past lives. We can talk to deceased loved ones. There's lots we can do. So julie@askjulieryan.com. Email me and we'll set up a date and time. All right, let's go ahead and go to the phones. And our first caller this evening is Daisy. Hi, Daisy.
Oh, hi. Yes,
Hi, how are
I'm calling
you?
from Ocala, Florida.
Hi, Daisy.
Because you told me that there was mold in my house, so I called a couple of companies. They came over, they looked around, they didn't find anything in my mobile home. I have a small single-wide mobile home. But I had the air tested, and it came back positive. And
Yeah.
I'm wondering if it's coming from the air conditioning unit or from my handkerchief full of alcohol that I use all day long to keep control of the inflammation on my right side of the head. Where is it coming from?
I get the air conditioning system. When you said that, I got a yes on that. And you and I have talked before, and I keep getting mold as the cause of your issues. So this is confirmation.
Yes, this is called Aspergillus penicillium, according to the page 8 of 20 pages I got from the results from the lab.
Right, right. And there's I believe it's an ultraviolet light, a UV light that you can put in your unit that will kill mold. And you may need to have your vents cleaned out too, Daisy. But as you know, that stuff can make you really sick because you've been suffering with it for a long time. So I'm delighted that you got that report and that you at least found that there is mold in your home.
It was a relief to find out that it wasn't in the house. It's just in the air. They took air samples and it came up positive, and it's only in a small part of the house. So that was there. I thought I was going to have to remove the house and get a new one or something, but no, it's not as bad as I thought it was.
Okay,
anyway,
good.
Thank you so very much.
You are so welcome. Start with that. and then go from there and see if you start getting better.
Yes.
And
that's a good advice because I'm going to have an antimicrobial treatment that is suggested. I'm going to do everything possible to get it removed.
Perfect. Okay. All right.
Thank
well,
you
I hope you feel better. Take care.
Yes.
Bye-bye.
Bye-bye.
Alrighty. Our next caller is Gurpreet, I think is how you pronounce it. Hi, Gurpreet.
Hi there.
Hi. How are you?
I'm good, thank you. Actually,
where are you calling from?
I just wanna.
Where are you located?
I'm calling from Calgary, Canada.
Okay, terrific.
Yeah. So I just wanted to ask one question about my wife's nephew. He died 2 years ago because of blood cancer, and he lived in Hong Kong. And so we just want to know that is there any chance that his mother wants to know that will he ever come back to them, or because she's trying to get pregnant, but so far without any luck, and she sees him in her dreams, and she feels that he's around and he wants to connect to her, but there's no definitive energy or anything she can feel. So she wants to know that what's going to happen.
Great question. It's been my experience that when spirits reincarnate, they don't come back to the same mother. We have people in our lives, everyone in our life is a soulmate, and we have people in our lives who we know either they're a family member or they're a friend or colleague or checkout clerk at the grocery store when we check out.
Mm-hmm.
And so what we can do is know that everybody's a soulmate, but I've never heard of somebody coming back to the same parents. It's usually a situation where he's already done that. His spirit's already done that. So he wants to explore and experience a new adventure. Now, that's not to say that his spirit isn't around her all the time. It is.
Mm-hmm.
And she can talk to him. All she has to do is just say something to him and he'll answer her, and it'll feel like it's a thought in her head. Do you have a parrot? What is that in the background? Do you have a parrot?
Oh, that's my daughter. Actually, sorry, she's 2 years old.
That's all right. She sounds like a parrot.
Sorry about that. Yeah.
No, that's okay.
Sorry.
So it's been my experience that that's not the case. Anything is possible. But will she get pregnant again? I get a yes.
Okay. And
so I hope that helps.
She tried two times and she was not successful. But she's trying the IVF treatment, but it didn't went through twice. So she's 40 years old, and she's worried about that she will get pregnant in future. And is there something that you can see or feel?
Well, I can send her to somebody, actually. She's one of my AAT grads, Angelic Attendant Training, the class that I teach. And she's an acupuncturist, and she's in Miami, Florida. But she works with people all over the world to help them with their fertility. And her name's Michelle Oravitz. And Oravitz is spelled ORAV as in Victor, ITZ. Have her go to michelleoravitz.com. And I believe Michelle can help her. She has a tremendous success rate of helping families get pregnant. Sure, that would be my recommendation. Okay. Take care. Thanks for calling. Bye.
Thank you. Bye. Yeah.
Bye. All righty. Let's go to Becca next. Hi, Becca. Hi, Becca. Are you muted? Okay. Let's go to Claudia next. Hi, Claudia.
Hi.
How are you?
How can you pick me? I'm good. Thank you.
Terrific. Where are you calling from?
I'm calling from San Diego, California.
Okay, terrific. You got a question for me?
Yes, I do. I have mom in the bed. She had a car accident, and she's unable to talk. She's eating from her stomach, a tube in her stomach. So I just wanted, to ask you if you can talk to her, because sometimes she tries to communicate with me, and he's frustrating because I can't understand her. And if she's saying the 12 phase, in what phase she's in, even if she's in one, I don't know.
Okay. What's your mom's name, Claudia?
Maria.
Maria. All right. Okay. What I'll do is I'm going to hold you over for the break. And when we come back, I'll scan her and we'll see what's going on and communicate with her at least. So stay with us, everybody. You're listening to the Ask Julie Ryan show, and we'll be right back after the break. Welcome back, everybody. Before the break, we were talking with Claudia about her mom, Maria. And Claudia, I took a peek at your mom while we were on break, and she is in phase 9 of 12 right now. What that means to those of you that haven't heard about the 12 phases of transition is, as we're dying, we go through a series of events that involve angels and deceased loved ones in a configuration that changes as we get closer to death. And there's 12 phases, 12 being we're taken to heaven by angels. So, Claudia, your mom is in phase 9 right now. If you go on my website, AskJulieRyan.com, there are graphics of these 12 phases of transition there, and you can find them, and it'll give you an idea of what they look like. Have you read my book, Angelic Attendants, yet?
I got it as an Audible, so I'm listening to it. Yes.
Okay. Yeah. So you know how it works with the phases.
Yes, I have an idea. Yes.
Yeah. Yes. So let's ask your mom.
Oh my gosh.
Are you ready to go? She's saying yes. Are you in pain? She's saying at times. What do you need? Nothing, just to go, is what she's saying. Yeah. So has the family all been around to visit her, Claudia?
Yes. They always come, they come and visit her, and friends and family. My sisters and my brothers, they do come and see her. But I haven't asked her that if she's ready or anything like that. I haven't. But I won't ask her.
Well, and you may want to tell her it's okay if she goes, Claudia, because sometimes our loved ones just need to hear that from their family, that you guys are going to be fine.
Yeah.
And it's okay for her to go. You don't want her to suffer anymore. And sometimes that can help.
Yeah.
Okay. All righty. Well, good luck with that.
And I also will make an appointment with you for a private session.
Okay. You know the trick on that, right? You know the trick on that, Claudia? Press the reschedule button on the confirmation email, and it'll show you appointments. Get on my calendar, and then it'll show you appointments that open up sooner. And this week so far, I've had 3 reschedule, and 1 scheduled it Saturday, and she got in Monday. So people, life happens when you're scheduling out a few months in advance. And so, okay. Good luck with everything with your mom.
Thank you very much.
Hey, Claudia, one more thing. Claudia, one more thing.
Yeah.
In order to find out what phase she's in, just ask. Just say, what phase is my mom in? You'll get an answer. It'll come in within a second, as fast as you can snap your fingers, and then refer to the chart, and it'll show you how the angels are positioned. Okay?
Will do.
All right.
Thank you very much.
Take care. You bet. Bye-bye.
Bye.
Bye. All righty. Let's go to, let's see who's next. I believe it's Linda. Hi, Linda.
Hi. Hi, Julie.
Hi, Linda.
How are you?
I'm well. How are you?
Hi. I'm doing
Terrific.
okay.
Good. Where are you located, Linda?
I'm in Tucson, Arizona.
Okay. Terrific. Got a question for me?
Yes, I do. When everyone talks about stress affecting the body, I got a bad scan back recently, and they're sending me to oncology. And it's like, I've had a ton of stress in my family over the years. Mm-hmm. And because I never smoked, I didn't do anything like that. The spots were in my lungs. And I just wonder, like, can you scan, or can you tell me what to try to not panic about or get negative about?
Sure. Yeah, absolutely. I'll get you on my radar and we'll see what's going on. The first thing I want you to know is everything can be healed. The body has a tremendous capacity to heal. So regardless of what diagnosis you get, always get a second, sometimes a third opinion. But we all have just an amazing capacity to heal. Our bodies do. So how this works is I'm going to connect to you. All right, great. Mm-hmm. I'm going to connect to you energetically. I'm in Birmingham, Alabama. I'm going to watch a laser beam hook into you. And then I'm going to have a hologram of you in my mind's eye. And it's going to be as if I'm looking at an X-ray or a CT scan or an MRI. 3 things are going to happen. Number 1, something will be identified. Immediately thereafter, there will be some type of energetic healing that will begin, and I'll describe that to you in detail. I'm very detailed in what I'm seeing in my mind's eye, Linda, because if you can envision what I'm seeing or at least get a sense of it, it's going to help integrate the healing into your body. So here we go. Here comes my laser beam from Sweet Home, Alabama, is what I like to say, and it's heading out to you in Tucson. All right, got you. Shooting energy from your feet up through the top of your head. Okay, the hologram that's you in my mind's eye, I'm looking at you from behind. So I'm going in. I'm in your, I can see spots in both lungs. The energy went to your left lung first. Are they finding spots in both lungs or in one or the other?
Right now, just one, the right one.
Okay, all right. I'm in the left one. And I can see spots in the left one. Sometimes I see them before they show up on the scans. So what I'm doing is I'm encapsulating them and removing them. Let me go to the right one. The ones on the left are smaller. The ones on the right are bigger. So the ones on the left may not be showing up.
I had radiation on years ago when I had breast cancer. But
the left one you did?
The right side's been, not the right.
Okay. All right. So I'm getting those encapsulated too, removing those. And then there's a spiral of energy spinning in both lungs, Linda. And let's do a DNA healing really quickly here. I see 7 strands of DNA that have come out of an X chromosome in your body. And I'm watching the letters in the DNA, which is the recipe that tells the cells how to behave. I'm watching those get resequenced. When they're resequenced, they'll snap back in. So this will help correct the mutation that's causing the cancer. I will continue to work on you over the break. Everybody stay with us. You're listening to the Ask Julie Ryan Show, and we'll be right back. Welcome back, everybody. Before the break, we were talking with Linda in Tucson, Arizona. And Linda, during the break, I worked on you. So I removed right before the break, you're welcome. Right before the break, I removed the cancer spots out of your lungs energetically. And then I did a DNA healing. And DNA is the recipe that tells the cells how to behave. You had 7 strands of DNA come out. They look like pieces of paper that you'd see inside a fortune cookie. That's what they look like inside of my head. Yes. And they're comprised of 4 nucleic acids. They're represented by 4 letters, A, T, C, and G. I watched those letters get rearranged as if we're playing Scrabble in warp speed, where you move a letter up and over and do that. Yeah. And then when the mutation's corrected, it snaps back into the chromosome, and then they all snap back in. And then what I did was I did a lymph cleanse in your lymph system, and the fluid in your lymph system, in everybody's lymph system, looks to me like the fluid inside an old-fashioned lava lamp. Do you remember lava lamps from the 60s and 70s? Yes. So I cleared those.
To remember those?
That's right. Me too. And I cleared those out too. So consider doing a private session with me, Linda, and then we'll have a whole hour to do a deep dive.
I'm signed up.
Perfect. Okay. Check the reschedule button on your confirmation email to see if there are earlier appointments that open up. And I'll look forward to getting you for a whole hour. But this will be a really good start for you.
Oh, good. It sounds like it. I hope so. And thank you.
You are most welcome. One other thing. Yeah, one other thing, Linda, and everybody that's listening, the way that this works is the healing happens on the energetic level, and then it integrates into the body. That can happen instantly. It can take days, weeks, months. It may need some kind of complementary care, like change in diet, medicine, surgery, whatever. But certainly it's always our spirit's prerogative to utilize the healing in a way that's going to best facilitate whatever it is our spirit's exploring. And keep in mind too, Linda, pay attention to how you feel when you talk to the doctors, because no doctor, no medical provider, no healer can heal another person. They help us heal ourselves. And an example of that is, think of whenever somebody has surgery. At the end of the surgery, the surgeon will stitch or staple or put steri strips on the incision and to help it heal. The surgeon doesn't make the skin heal, doesn't make the skin grow back together. The patient does. So we all heal ourselves. Yeah. So keep that in mind. Pay attention to how you feel when you go forward with this. Okay? All right. Look forward to talking to you soon. Take care. Bye-bye.
All right. Thank you.
All righty. Let's go to Melissa next. Let me find Melissa. Here she is. Hi, Melissa.
Hi, Julie.
Hi, Melissa.
Thanks for having me.
How are you? You're welcome.
I'm good. How are you?
I'm great. Thanks. Please tell everybody where you're located.
I'm in Guadalajara, Jalisco.
Okay. Say that again.
Guadalajara, Jalisco.
Okay. Which is in Mexico, right?
Yes.
Yeah. You say it so well with that fancy accent. Well, you got a question for me, girl?
Yes, I do. The other day, about 4 days ago, I started developing a rash on my arm.
Say that again. You there's a lot of background noise. Is that you?
No, that's not me. I think that's from someone else's.
Okay, let me mute that person. Okay. So go ahead. I'm sorry.
Okay. That's okay. 4 days ago, I started developing a rash on my arm, and I took Benadryl. My sister's a doctor and just told me to take some Benadryl to see if it was an allergic reaction. It didn't do anything. And then she told me to go get it checked out. And so I went and got it checked out, but I still didn't really get a clear answer on what exactly it is. And I was just hoping that you could maybe do a body scan and give me some information on what it possibly could be.
Sure.
It's like Lyme, a Lyme disease has been mentioned, and then like bacteria. I don't know. And then I found a tick on my dog, so I don't know what's going on. What it is. It's just coincidental or.
Yeah, that's scary when you find a tick on your dog. Well, you haven't been rolling around in a patch of poison ivy, have you?
No.
Okay, good.
It hasn't moved. That's the thing is it's not moving. It's staying in one spot, and I've touched it a lot and, put it on my face to feel the heat, and nothing's moved anywhere. So.
Well, you're brave doing that.
I know.
Okay.
Yeah.
Well, I don't know that I'd be doing that, but I get that it's yeast related. It's a fungal infection. So how's your gut? Is your gut kind of upset? Have you had any bloating or gas or anything like that that's been out of the ordinary lately, or athletes?
A couple months ago, I had a bacterial infection in the gut. And then, it was like really deep pain for about a week. And then my stomach's still been a little bit sensitive since then. So.
Did you take antibiotics, Melissa?
No, but I bought some antibiotics today. I have doxycycline. And the doctor just recommended, if it is a Lyme bite, to go really hard on the doxycycline. And I'm just I know it's a really intense antibiotic, so.
Well, I'm not getting it's a Lyme bite. I'm getting it's a fungal infection. And so what you want to do is get an antifungal. You see if you can. Is your sister in Mexico? Can she call in a prescription for you?
Oh, I can just walk right up and get one.
Okay. You have the power. You have the connections, huh? Okay. Yeah, go get some nystatin.
Nystatin?
Nystatin. Try that. Nystatin.
Okay. Is it like a topical, or is it?
It's not. It's internal. It's a tablet. They will have a topical cream that you can get an antifungal cream. I would put it topical, but I'm getting this as a fungal infection. So I hope that helps.
Interesting. Yeah, and it just comes from the gut. Is that where it starts?
Yeah, that's where most rashes come from, unless you've been rolling around in a patch of poison ivy or something. But that's normally what happens with that. So I hope that helps.
Okay, well, thank you so much.
You're welcome. Thanks for calling. Take care.
All right.
I know.
Okay.
You bet. Bye-bye. All right, let's go to Sabina next. Hi, Sabina.
Hi.
How are you?
I'm good. I first got connected to your work when you were a guest on Michelle Horowitz's Fertility Summit. So I'm really grateful you did that.
Yeah. Well, and then I just recommended her. How about that? She's fabulous.
Yes. Yeah, exactly.
Yeah, she's really terrific. And she's an amazing gal, and her patients really, she has a huge success rate of helping people get pregnant.
Yeah, which leads into my question.
Okay.
I am 38 years old. I've been trying to get pregnant for 2 years now with no luck, and I've been diagnosed with unexplained infertility, but my labs at the fertility clinic have all come out basically clean, and so is my partner. So I was wondering, is there a reason behind my infertility, something I can work on?
Yes, you have two babies' energies above your right shoulder, and what they look like are little orbs, and they're right above the shoulder of the mom. They're not twins; they're spaced out, so don't have a heart attack here on this. Most people, I'll say, okay, you got two babies' energies or three babies' energies, and they'll say, oh no, I don't think I can do triplets. I'll say, no, they're spaced out, so they're not.
Yeah, that would actually be hard for me because I have spondylolisthesis, so I've had back problems for a number of years. But anyway, so you said they're not twins, so.
They're not. No, they're spaced out. And when they're spaced out, Sabina, what they look like to me is, you know how you go by the airport at night and the planes are lined up with their landing lights on getting ready to land, and you got them spaced off in the distance waiting for clearance to land? That's what these babies' energies remind me of. Yeah, you got two of them. So go get a book, order it, and it's called The Better Baby Book. The Better Baby Book, and it's by Dr. Lana, Lana, Asprey, Asprey, The Better Baby Book. And that will give you a lot of information that will help you with your fertility about what to do. She was told she would never conceive, and she did in her mid-40s and had two babies, and she restored her fertility. So the Better Baby book.
Yeah, I wasn't. Thank you so much. I have a bunch of books, great books, and I'll definitely get that. I wasn't sure if my problem's physical, like viral, or if it's like more spiritual, like the timing's not right, whereas I can...
Okay, well, I'm going to need to hold you over for the break because I'm hearing my music. So stay with us, everybody. You're listening to the Ask Julie Ryan Show. When we come back, I'll get Sabina back on and we'll see what she has to say. Welcome back, everybody. Before the break, we were talking with Sabina. Sabina, you forgot to tell me where you're located. Where are you located?
Seattle, Washington.
Seattle. All right. Okay. So you were asking me about physical and emotional and all of that. I'm getting that you need to tweak your diet a little bit, add more good fats. I'm scanning you look like you got plenty of eggs. I'm coming down your right tube, coming down your left tube in your uterus. You look good to me. So, you may want to schedule a full hour appointment with me and we can do a deep dive, but on the surface, it looks okay. And I see two babies' energies. So I think it's just a matter of time. So consider scheduling a whole hour, and then we'll do a deep dive and see what's going on.
I will. Thank you. And I just wanted to say that I love your style that's so like light and bright about heavy issues. I just really love that.
Oh, thanks. I've had people tell me that all the time, and I say, this is spirit working through me and with me. It's supposed to be fun. It's pure love, and everything can be healed. So I don't edit anything I get, and I've seen amazing things happen with healings. So I'm seeing two babies, girl. You're going to be a mom. So I'll help you any way I can.
Love it. Thank you so much, Julie. I'll try to get the appointment. Bye.
Okay. Bye-bye. Okay, let's go to Kate next. Hi, Kate.
Hi, Julie.
Hi, Kate. I can barely hear you. Say something.
Hi, Julie.
Hello? There, that's better.
Hi, Julie.
I can hear you. Thanks. Terrific. Where are you located?
Yes. I'm in Philadelphia.
Okay, terrific. You got a question for me?
I definitely agree with your last caller. I really, it makes all the difference.
Oh, thanks. You're kind of going in and out a little bit. Maybe hold the phone a little closer to your mouth.
Okay.
I
wanted to say my husband passed 2 years ago.
Oh.
And I'd like to know if he's nearby, or is there anything you can tell me about him?
All the time. He's with you all the time. Yes. Whenever you think of him, our heads are big satellite dishes, Kate, and they receive and they transmit frequencies. Every spirit has their own frequency they keep throughout all of their lifetimes. So when we think of somebody who's deceased, we connect with their spirit's frequency. And if you're doing something random like cooking dinner or folding laundry or making your bed or something, and you think of your husband, what was his name, Kate?
Walter.
And you think of Walter, while you're doing whatever, gardening or whatever. That's him letting you know he's close by. So do you have a quick question for him?
Yeah. Is he happy?
Is he happy?
Is he doing anything Yeah.
Yeah, he's in heaven. Doesn't get any better than where he is. What he's talking about marshmallows. What's the marshmallows? Do you love marshmallows? Did you make s'mores a lot, or what's up with that?
I don't like marshmallows.
Did he like marshmallows?
No.
Okay. It'll come to you. It happens often when I'll say, okay, your husband's talking about marshmallows, then the person will say, that doesn't mean anything to me. And then I'll get an email within a week or two. And they'll say, when you heard marshmallows, this is what it means. So something to do with marshmallows. I don't know. Marshmallows are kind of like eating air. Yeah. So did you have another quick question for him, Kate?
But I'd like to know if
I'm not able to hear you. I'm sorry. Try it again. Okay. Well, we're going to have to go to somebody else because I couldn't hear. All right. Kelly. Hi, Kelly.
Hi. Oh, yeah, meant to be.
Meant to be.
I was the Kelly from Smithtown who a couple weeks ago was chatting with her husband and didn't hear you. So I got bumped off for a wonderful woman that I was bumped for a reason. I was bumped because that woman needed help. So it was amazing, and it was your last call. So I am calling now for my brother. His name is Chris. And I asked him at that time if he was open to this. So he said yes.
Okay.
I didn't know how to ask you this. I don't know if it's a medical problem with him or a mental problem with him. Can I say that? And then you just kind of tell me which it is?
Sure.
His name is Christopher. He lives in Florida. He does take thyroid medication, which is kind of unusual. He's in his 50s. He's overweight, and he's just not happy. And I'm not sure if it's emotional or if it's physical.
Both. It's both. Get him the book, Why We Get Sick, Kelly, by Ben Bickman. Okay. Bikman. Do you have a pen? Ben Bickman.
Yep, got it.
And he is an endocrinology researcher at Brigham Young. He's a professor there. Okay. And he talks about what happens, with brain chemicals and all of that. And it all has to do with what we're eating. It's pretty fascinating. And it all boils down to what we eat. And the root cause of a lot of the problems is sugar or things that are refined. So get him Why We Get Sick. And that thyroid, has he had it removed, or is it just he's got a sluggy thyroid?
No, but he just takes a Synthroid type of medication.
Okay. That can be reversed in a lot of instances with diet.
Okay.
And the brain chemicals are made in the gut. So most people don't think about that. They think they're just made in the brain. They're not. They're made in the gut. And so when our guts are out of whack, it affects our moods and our depression and anxiety and things like that. So Why We Get Sick by Ben Bickman. It's an audiobook and regular. Aren't you nice? Aren't you a nice sister to do that for him?
Yes. Yeah, you know what? I'm just loving this. My sister has called a couple times. She's on hold right now for her question. And it's just amazing how you help people. It really just is amazing. It gives us a relief. I had the infertility like the other girl, and to trust is a very big thing. When you told her 2 babies, I was told that too. You don't want to believe that. You want to believe it, but you want it quicker. So you want the medical solution. You want the what can I do part. Right. It's difficult to trust.
Right. So, well, thanks for calling. Thanks for calling, Kelly. Everybody, it's time to go to break. We'll be right back. You're listening to the Ask Julie Ryan show, so stay with us. Welcome back, everybody. We do this show every Thursday night at 8 Eastern, 7 Central, and 5 Pacific. The call-in number is 712-775-7035, and the access code is 483-620#. This information is available on my website, AskJulieRyan.com, and in the show notes. You can download the show anywhere you get your podcasts, and we're also on YouTube and Alexa. So please remember to subscribe and leave a review, easy for me to say, leave a review at ratethispodcast.com/Julie. Again, that's ratethispodcast.com/Julie, and you'll be entered to win a free session with me. Like, what is it? Trees P from the UK, who won hers earlier this evening. So I still think that's a hilarious name. Okay, what else? Call-in details can also be found on Instagram, Twitter, Facebook, and Pinterest. Everything's at Ask Julie Ryan on all social media. We post a reminder to call into the show with the call-in numbers on the day of the show. And of course, it's on my website. And when you're on my website, be sure to sign up for my weekly newsletter, because that's a question somebody has submitted online, and then I answer it. And in the body of the email, it has, okay, here are the call-in numbers. I'm trying to make it easy on you guys to call in. So let's see what else. You can also schedule an appointment with me. Then we'll have a whole hour to talk about whatever you wish. I've mentioned already, get on my calendar. And then when you get your confirmation email, save it, and then click the reschedule button when you think about it. And earlier appointments, when they become available, will show up. We tried to keep a wait list, and it was just too crazy to try and do that. And frankly, when somebody reschedules, the appointment gets taken up before I even know about it, because I check my emails at the end of the day after I'm done talking with clients. So it's just easier if you just check it, and then it's always fun when one opens up. But I just trust that we talk whenever we're supposed to. So everything you need to know is at AskJulieRyan.com. By the way, I finished the angelic attendant training for July on Saturday. What an amazing group. They all are. They're all just fabulous. And then October is fall, and January of 2021, I have 2 spots left. So if you're thinking about taking my class, you want to get in there, because that's going to fill up. And I teach it once a quarter, and I limit it to 12 people. And it is absolutely life-changing. You get to learn how to do all this stuff that I do, because, I learned how to do all this. And it's a blast. And then you're involved in a global community of people who've been through the class from 10 countries. The prerequisite is you got to speak English, because that's the only language I speak. And then there's something that's online 5 days a week that the graduates do. And so it's really terrific with that. And then you get to practice, what's going on, and increase your skills. So AskJulieRyan.com. Everything's there. All right. Here's the question from this week. Let me put on my glasses so I can see what the heck I'm reading. You think I'd wise up and just make this print bigger, but I haven't figured that out yet, I guess, that I need to do that. Actually, I probably just forget to do it when it happens. So Suze from East Hanover, New Jersey asked, "Hi, Julie. Can someone be in the middle of the 12 phases and actively be living their lives, like going on errands and doing chores? Love your show. Thanks, Suze." And here's my response. Hi, Suze. First, thanks for your kind comments about my show. I love doing it. Second, what a great question about the 12 phases of transition. Everyone goes through a process I call the 12 phases of transition when they die. It involves a configuration of angels and the spirits of deceased loved ones and pets, and changes as we approach death. This occurs whether we die instantly, like in the case of a homicide or suicide, or whether we take days, weeks, months, or even years to pass. By the way, one of my best girlfriend's husband is dying right now, and he's been telling her for the past week that his mom has come to get him, and it's the maternal spirit that runs the show from the spirit world. He can see his mom and he can communicate with her, and he told her he needs a little more time. So she said that he talks to his mom and he knows her spirit's in the room. So I think that's amazing. So I went on to say, if we remember time doesn't exist in the spirit world, it's a human creation, it's easier to wrap our heads around this concept. Having said all that, yes, it's entirely possible to be living life to the fullest and then transition. Happens all the time. In addition, it's also possible to move backwards from advanced phases of transition and to even decide to live. My brother's friend was in phase 11, and I fully expected him to quickly pass. His spirit had other ideas because he healed and is still living 15 years later. And then I closed with Hay House founder Louise Hay had the right idea when she said, "Happy, healthy, dead." I love that. Happy, healthy, dead. That's what I plan on doing. Happy, healthy, dead. So thanks, Suze from East Hanover, New Jersey, for sending that and submitting that question online. If any of you want to submit a question online, your question may get chosen to be read on the air, and just go to AskJulieRyan.com, Ask Julie, the Ask Julie page, and then just put your question in there, and it may get chosen. So there you go. All right, let's go back to the phones, and our next caller is Ricky. Hi, Ricky. Hi, Ricky. Are you there? Hello, hello. Are you on mute? Okay, well, I guess not. Then let's go to Yvette next. Hi, Yvette.
Hi. Hi, Julie.
Hello, hello. How are you?
Can you hear me?
Yes, I can. I can. Where are you located?
Hi. I know my number says 818. I just moved to Idaho from California, so now I'm in the Eagle, which is a suburb off Boise. Yeah,
wonderful.
Idaho. Loving it.
How do you like it?
I'm loving it. Yeah.
Good.
A whole different, slower pace vibe here. And it's
I
beautiful.
understand.
Lots of outdoor stuff to do.
I understand there's a California invasion in Idaho.
There is. Oh, my gosh. All my neighbors are from California.
That's what I've heard.
Yeah, it's booming out here.
Driving the prices up, I hear.
I know. They are. We are. It's really terrible. It is.
Terrific.
We got in just in the nick of time.
Good. Well, you got a question for me?
I do. I'm kind of having a little bit of an existential crisis. I've been, and I don't even know if you can address this question or not, but I will try. I've been a nurse for 26 years, and I'm now at risk of losing my job due to the vaccine mandate.
Okay.
So I'm just wondering if somehow you're able to tell me if my future in nursing is coming to a close, or what do you see in this situation?
Yeah, it's becoming problematic for a lot of people in healthcare that don't want to do it. I know that there are lots of strategies that people have that say that since it's an experimental shot, it's really not even a vaccine. They're calling it that, but it's really not a vaccine, that they can't mandate it by law. It's not able. So I would go to, do you have a pen, Yvette?
I do.
Go to America's, plural, America's frontlinedoctors.org.
Yep.
Go to americasfrontlinedoctors.org and look on their website. I believe they have a section for legal, and see if that helps. See if you can get some information there. I do know that if it's not FDA approved, they cannot mandate it legally. But I think what's happening is a lot of people are just saying, I can't afford to lose my job, so they're just getting it. They're just getting the shot.
Yeah.
And I think that's a decision that everybody needs to make for themselves with their doctors.
Right.
Yeah. So
I agree.
If it, if it feels right for you, do it. If it doesn't, then trust that the information you need and the people you need to help you are going to show up when you need them.
Okay. That's
because
what I'm trying to do. I'm reaching out to my guardian angel every day and to God.
Right. And when we're in a panic about something, we're out of alignment with our spirit, and spirit can't communicate with us because spirit doesn't communicate on the I feel crappy channels. The vibration's too low. So what you want to do is you want to ask yourself, is this going to kill me in the next 2 minutes? If it is, get out of the street before the bus runs you over. You know this story. If it's not, then that's an irrational fear. And it's false, and you're making it up. So do that. Stay in alignment. When you feel good or neutral, you're in alignment with your spirit. Spirit can communicate with you. When you're not, when you feel badly, Spirit cannot communicate with you because the vibration's too low. So I call it the 2-minute rule. Just ask, is this going to kill me in the next 2 minutes? It's a yes or no answer. It's not a no, but it's just yes or no. If it's yes, change the conditions. If it's no, it's a false fear. You're making it up, even though it feels real.
Okay, Julie.
Okay.
Okay.
So that's how it goes. All right. Well, good luck.
You do.
You bet. Take care.
Thank you. Okay.
Bye.
Thanks. Bye-bye.
Stay with us, everybody. We're going to take a quick break. And when we come back, we'll come back to the phones and we will get our next caller on. You're listening to the Ask Julie Ryan Show. We'll be right back. Welcome back, everybody. Let's head back to the phones and let's try Ricky again. Ricky, can you hear me? Hello, Ricky.
Yep.
Hi, there you are. Hi.
Oh.
Where are you calling from? You sound like you're on Mars.
Hello.
Hi.
Can you hear me?
Yes, I can. Where are you calling from?
I'm calling from China, Hong Kong.
Oh, my goodness. Wow. Well, thank you for calling that.
Because you remember at the start of the show, there was one group priest from Calgary.
Yes.
Talk to her.
Yes.
You remember? He asking about his nephew who died. Actually, I'm the father of that kid.
Oh, goodness. Okay. I'm so sorry about your son.
Yeah, because I just want to know, is it possible to get connected to him, or how is he doing now? Any idea?
Absolutely. What's his name, Ricky?
His name is Rasan. Rasan.
Rasan. Okay. Yes. Yes, he's standing to you to your right now. So our heads are big satellite dishes. Ricky?
Yeah, as Gurpreet told you, my wife is in India and she's trying to go to the test tube and all that stuff.
Yeah.
So is there any chance he'll be back?
Well, like I told your relative, it was Gurpreet, I think, is that it's been my it's been my experience, Ricky, that spirits don't reincarnate to the same family in the same lifetime in the same configuration, because our spirits want to have an exploration. We want to experience different things in different ways. Certainly we can reincarnate with the same people in different roles, but it's rarely in the same family at the same time. Now, that's not to say that a new baby won't come.
All right.
I think they will. I think your wife will have another baby, but I don't believe that Ricky will come back. Now, anything's possible, but that's what I'm getting right now.
Yep.
But you can talk to him at any time. You know that?
But how? I mean, in which way?
How you do that is you just say something to him either in your head or aloud, and he's going to answer you. His spirit's going to answer you, and it's going to come in as fast as you can snap your fingers. It's going to come in really fast. And then it's going to feel like it's a thought in your head.
All right.
Okay? And so the more you do it, the more validation you're going to get for the information you're receiving, and the more you're going to trust it. The more you trust it, the more you do it, the more you practice, the better you're going to get at it. Everybody has the ability. And you probably talk to him now, right? In your head? Do you ever do that now? I think I lost him. Okay. Well,
all the time.
Oh, no. Okay, now you're back. Do you ever do that now? You can feel him around you? Yeah. Yeah. So just say something to him. Say something to him, and it's going to come in like it's a thought in your head, and that's going to be him answering you.
Right.
If you think about it for more than a couple of seconds, Ricky, that's going to be your brain. Okay?
Yeah.
Okay.
All right.
What time is it in Hong Kong?
Thanks very much. Nice. It's
okay.
9:30 in the morning, Friday.
9 in the morning, Friday. So
we're
talking
about 12 hours ahead. Yeah.
We're talking to you real time in the future. Yeah, fabulous. Sure. Okay. Thanks for calling. Take care.
I'll send you an email later, all right?
Okay, sounds good.
Bye.
Bye now. Okay. All right. Let's go back to the phones and see who we have next. I believe it's Erica. Hi, Erica.
Julie, how are ya?
I'm well. How are you?
I am good. I have a question for you on my mother's behalf.
Okay. Well, tell us where you're located first.
I am in Fort Myers, Florida.
Okay.
And my mom is in Centerville, Ohio.
Oh, I know Centerville. Pumpkin Festival. Or is that Circleville?
I know.
Yeah.
Yes, we've spoken before, and my family knows your brother, the Boys Halloween store.
Yeah. That's my cousin, Michael.
Cousin, okay. I always say it's your brother, but it's okay. Apparently it's your cousin.
My cousin. Yeah, my dad and his mom were siblings.
Okay.
Wonderful. Well, what's your question?
Okay, so about 7-8 years ago, my mom lost her sense of smell. And she was also diagnosed with multiple sclerosis. We went through like a really traumatic family event. And I think the stress of everything that happened, I think kind of gave herself this disease. So I want the poor woman to be able to taste her food. We're Italian. She loves to cook, and she cannot taste anything. And I think that's got to be really frustrating and just not cool. So I want to see if there's anything we can do to get her senses back.
Oh my gosh. Yeah, that's just wrong. An Italian who likes to cook that can't taste. That's just wrong.
Horrible.
Oh gosh.
Yeah, I know.
Oh my. We were talking to my sister-in-law and brother-in-law in Michigan last night. Tim and I were, and we're going to get together soon. And she said, I'm going to make manicotti for you. And I think Tim was just salivating even listening to it because she's Italian and she's an amazing cook as well. So, Erica, I'm going to need to take a quick break. So I'm going to hold you over for the break. Everybody, you're listening to the Ask Julie Ryan show. And when we come back, we're going to see if we can get Erica's mom's sense of smell and taste back because, she's an Italian mama that likes to cook. So we'll be right back. Stay with us. Welcome back, everybody. Before the break, we were talking with Miss Erica in Ohio and about her mama that wasn't able to smell, and that meant that she couldn't taste. Did you tell me she was diagnosed with something, Erica?
Yes, she was diagnosed. I can't remember if it was shortly before or shortly after with multiple sclerosis. Which she hasn't really had any symptoms of it. She says, like, sometimes she loses her balance a little bit when she wakes up in the morning. But anybody could kind of feel that way when they first wake up in the morning. So she's had really minor, if any, symptoms. She's never taken medication. She eats very clean. So I kind of think she doesn't even have it personally.
It's really hard to diagnose that. It's usually if they see lesions, in the brain or in the spine. So what I did was I worked on her during the break, Erica, and I watched a procedure, and I usually see this on the spine for a healing, but I watched her nasal cavity. I watched this instrument like they use in the operating room go in, and it's an expander. It's like looks like a little, what an eyelash curler looks like. So imagine it's sideways, but it's got two little arms on it that you can push the tissue out. So I watched her nasal passages get heated with a laser to make them pliable, like a potter with clay, when they're making something. And then I watched.
She told me she had a procedure done.
Okay. And I watched this instrument go up into her nose, both sides go up through her nostrils, and expand the tissue in her nasal cavity to get it so that she could have free flowing air in there. And I watched that happen on both sides. And then I watched it get lasered again, like a potter would fire clay, to finish off their bowl or base or whatever they're making so that it's solid. And then I went up further into her nasal cavity and I removed mold. Has she had mold exposure? Do you know?
Not to my knowledge, but that was my thought. So she wouldn't know if she's never been tested for mold, but I've listened to your show so many times now, and I feel like I bet you she's probably been exposed to mold. That was just my hunch.
Yeah. Yeah. So when you get a hunch like that and it keeps coming in, and that's Spirit saying, yeah, you're right. Pay attention to this. So go get her, or you read, or both of you, or listen to a book called Toxic by Neil Nathan, MD. Toxic by Neil Nathan, MD.
I haven't gotten it yet.
Okay, so that's on your list. So get that, read that. In the meantime, shoot me an email, julie@askjulieryan.com. I will send you the link for the gut biome test, which is a fancy name for the poop test. What's that?
Yes. You told me about this before.
Yeah. So, julie@askjulieryan.com. Right? Pardon me?
You said it's called like biome, right?
That's right. Okay. And the link I'm going to send you is going to be for a little bit of a discount. And then what you want to do is you want to get her to do it. It's a fancy word for a poop test, basically. I had somebody say the other day, what's a gut biome test? I said, it's a poop test. And she goes, oh, okay, just say that. I said, all right. I mean, gut biome sounds a little bit fancier, don't you think? And so anyways, I would have her do that because food is the best medicine, Erica. And let's find out what her superfoods are, because this test is going to tell her, here are your superfoods, eat this, eat these, incorporate these into your diet, even if she can't taste them. I mean, what the heck? Here are the foods for you to avoid, some of which she may be eating and they're healthy, but they're just not healthy for her. And then here's everything else. Eat this a lot, eat this a little. So email me, julie@askjulieryan.com. We'll send you the link.
Perfect. And is there anything that she can do to remove the mold from her nasal cavity?
Yeah, rinse, sinus rinse. Yeah, absolutely. Yeah. There's, Google that with saline. Yes. Yeah, I think she's got a fungal infection in her nasal cavity. So I'm going to need to run to get some more callers on, but email me and we'll send you that link.
Thank you so much, Julie.
You bet.
Okay,
take care.
You.
Bye.
All right, you too.
All right, let's go to Outta. Hi, Outta.
Hi, can you hear me all right?
Yes, ma'am. How are you?
Hello. Oh, okay,
hello,
great.
Hello.
I'm good. How are you?
I'm great. Where are you located?
I'm currently in Los Angeles.
Okay. Terrific. You got a question for me?
Yeah, I do. So I have been in great need and really deeply desiring a service dog for multiple issues. And I keep coming up against so many obstacles, most of which are financial, but also injuries. And I'm just kind of looking for some guidance. Like, is this meant for me? Do I need to wait? Is it coming? All those sorts of questions. So, is there something I need to do? Yeah.
Okay. A service dog to help you because you're vision impaired, or what's going on with that?
Yeah, it's more psychological, like anxiety and PTSD.
Okay. And are you going through a foundation to get the dog, or are you trying to buy one that's trained? What's the story on that?
I've kind of dipped my toes in different areas. I'd love to go through an organization, and I found a couple I like, but it is so expensive. And so I've also considered training on my own, which I know is a possibility for some people. So,
yeah. The other thing I'm getting,
I'm just not really sure what route to go.
Yeah. The other thing I'm getting is to see in the shelters if there are provisions for service dogs, like if any of them ever come to the shelters, or if they have certain breeds or certain dogs that end up being good candidates for the training. I'm getting that it may be less expensive for you to have somebody train the dog for you instead of you buying a dog that's already trained, for you to pay for the training instead of getting a dog that's already trained. And there's something there with the shelters, and certainly the LA Humane Society, LA County is going to be huge, I'm sure. And I would call them and talk to them and see if they have any kind of special programs that can help you.
Okay. And are you able to pick up on, if it's something that's coming my way soon, or if it's years down the line that I have to wait for it or anything?
I don't get soon, and I don't get years down the line, but I do get that you need to take some more action on it. It's not, this pup's just not going to show up at your door. You're going to have to engage some more and do some investigating. Pretend you're a secret agent and you're doing some investigating on this.
Right.
So I'm getting that you will get one.
So is it? Okay. So it is the right choice for my psychological issues?
I don't know that there's a right or a wrong choice. It's certainly something that's viable if you choose to pursue it, but you're going to need to take some action on it. Okay?
Okay.
All righty. So I hope that helps.
I really appreciate
You're
that
welcome.
Insight.
Thanks
so
for
much.
calling.
Thank you,
Take
Julie.
care.
Okay.
Bye-bye.
Have a good night.
All right, let's go to Anna next. Hi, Anna.
Hi, Julie.
How are
Anna
you?
From Hollywood, in Florida.
Where are you located?
Anna from Hollywood in Florida.
Hollywood, Florida. All right. Well, great. I know where that racetrack is. That's a famous racetrack there.
Yeah, near the Gulf Stream.
That's right. Well, you got a quick question for me?
Very, very close to my... Yes. I'm getting, it's similar to the lady from Guadalajara. She had a rash on her arm. And every now and then, on and off, not constantly, but on and off, I have rashes coming up my leg. Most of the times is the left leg, but lower left leg from the knee down to my ankle. And this time it showed up also on the right leg. Still from the knee down to my ankle. And I have a feeling that is connected to anxiety or stress, and therefore to my liver and the spleen. So I was wondering whether you can have a look to my internal organs and see if you see maybe an inflammation or anything, abnormal.
Sure.
Especially liver and spleen. That's what I think is connected to my rash.
Okay. All right. Well, I'm going to hold you over on the break because we're going to need to take a quick one. Everybody, you're listening to the Ask Julie Ryan show. And when we come back, we'll talk to Anna again, and stay with us. We'll be right back. Welcome back. We had Miss Anna from Florida on the phone here on the line before we went to break. And I scanned you over the break, Anna, I guess is how I should say your name. And what I got was you have a fungal infection. We had somebody call in earlier about a fungal infection with a rash. And your spleen looks okay, but you were talking about your liver. Your liver's got a bunch of, it looks like white powder. It's yeast in it. So email me, ask Julie at AskJulieRyan.com, and I'll send you the link for the gut biome test. And then I would get a hold of some nystatin, which is the antifungal, NYSTATIN. And hopefully that will help.
Yeah.
Okay.
Okay. Thank you so much.
All righty. Thanks for calling. Bye-bye.
Thank you so much.
Bye.
Bye-bye.
Okay. We've got somebody from Ames, Iowa. Hi, this is Julie. What's your name?
Hi, this is Pat.
Hi, Pat. I know where you're from. Are you from Ames, Iowa, or is that just an old phone number?
That's just where I picked up the cell phone at.
Perfect. You got a quick question for me?
I am in Iowa. Yes.
Okay. Terrific.
Okay. Quick question. I have some pain all over the body. I'm hoping for a scan that will maybe zero in. Maybe it's all related. I don't know if it's, I'm getting old, so maybe it's arthritis. I just kind of like to maybe find out maybe where's the worst area, and maybe you can zero in on it and find out what's going on. I like to walk, but I can't seem to walk as far as I would like to before my feet hurt. I do have back pain, joint pain, and a boatload of other things, but let's just focus on the pain.
Okay. Well, your whole body looks inflamed. I'm in a red room with red foam because I'm in my recording studio here at my home, and you look like you have red fog over your whole body, which is inflammatory energy. So I'm getting that calmed down with anti-inflammatory energy, which is a royal blue color. And so that's going to help the pain in the short run. I do see arthritis in your joints, so I'll clean that out. We'll inject a little bit of stem cell energy in those. That will help regenerate the cartilage and kind of give you a lube job all over your joints. I sound like a mechanic, don't I?
Okay.
Oh, yeah. You just never know. You may call into my show and get a lube job. I mean, you just never know. So stem cell energy, Pat, is the coolest stuff because it will regenerate any body part we need. And it looks like a light amber colored gel. It has sparkles in it because woo-woo, gotta have sparkles. And it reminds me of Dippity Doo hair gel. Do you remember that from the 60s and 70s?
Oh, yeah, exactly.
Is that hilarious? Yeah. I know. Looks like Dippity Doo. People say to me, I haven't thought of that stuff in 50 years. I said, I know, but that's what it looks like. So I'm watching a vortex spin above your head, below you, in front of you, behind you, on either side of you. That's going to help regenerate all of those joints. Two quick things. Email me, Julie at AskJulieRyan.com. I'll send you the link for the gut biome test. Let's do that. Inflammation usually originates in the gut, unless you fall and break your leg or something, and you've got inflammation from that. But when it's all over the whole body like that, it's usually in the gut. That's number one. Number two, schedule an appointment with me. We'll have a whole hour to do a deep dive. I can go in, clean out all that arthritis and stuff like that. Arthritis looks like battery corrosion, like on a car battery or a battery in a flashlight, when they kind of fail and then they get that crunchy stuff on them. That's what it looks like. And that's what yours looks like. So we'll have a whole hour to do a deep dive and get on my calendar and then check the reschedule button. And then that'll show you when earlier appointments
I noticed you're clear into November right now, so it's like I had to hope to get on.
Yeah.
Get just a little something going before I could talk to you.
Yeah. Well, I'm telling you, people reschedule all the time. I mean, I'll have multiple people each week reschedule because you're scheduling out a couple of months and then life happens. And a lot of times you can get in. Yeah. So in the meantime, email me. Let's do the gut biome test for you. That'll tell you what your superfoods are and how to reduce inflammation with what you're eating and help get your gut healthy. That's going to give you a lot of relief from that right there.
Okay.
So I hope that helps.
Okay, and that's everything. That's the seed. Everything is all arthritic or not? Say
that again.
I said I have pain in my feet too, especially when I walk. But is that arthritis too?
Well, it's inflammation, and inflammation usually comes from the gut.
Inflammation. Okay.
Yeah. So I did see arthritis
so we're
too.
Still talking about gut stuff,
Yeah. Gut. Email me. We'll get you that link. Hope you feel better.
Okay.
All righty.
Bye. Thank you for your help. Bye.
You bet. All right, everybody. That's it for this week. What a treat. I don't know how many people we got on it. It was fun. So I do my best to get as many on as we can. For those of you that called in that I didn't get to, please call back next week, and I will do my best to get you on. For those of you at home, I hope you have a wonderful weekend and a terrific week next week. And I'll meet you back here, same place, same time, same station, and sending you lots of love from Sweet Home, Alabama. Mwah. Follow me at AskJulieRyan.com, Ask Julie Ryan on all the social media, Twitter, Facebook, Instagram, what am I forgetting? Pinterest. And then you'll be able to find me there, and we'll post show notes. We'll post all the information about the show, and we'll rinse and repeat next week. So take care, everybody. Bye now.
Be sure to follow Julie on Instagram and YouTube at Ask Julie Ryan, and like her on Facebook at Ask Julie Ryan. To schedule an appointment or submit a question, please visit AskJulieRyan.com.
This show is for informational purposes only. It is not intended to be medical, psychological, financial, or legal advice. Please contact a licensed professional. The Ask Julie Ryan Show, Julie Ryan and all parties involved in producing, recording, and distributing it assume no responsibility for listeners' actions based on any information heard on this or any Ask Julie Ryan shows or podcasts.